My name is Dr. Tang, and I work with NorthBay Health. I am an internal medicine physician. I love what I do. I'm always honored to be my patients' physicians and for them to be so open and willing to talk about their medical conditions and how we can work together to improve their livelihood. So most of the patients that I've seen describe me as somebody who knows their medical history pretty well as I review their chart before seeing the patients, as well as priding myself in optimizing medications. So I try to decrease pill burden on patients so that they're only taking medications that they really need as opposed to what may be just treating symptoms. This is my first civilian job. The prior 6 years I've been in the Air Force, initially working in primary care. Majority of my patients in that population were 50 to 100. On deployments, it tended to be younger active duty patients. And so I feel like I've had a wide range of medical experiences, both with the military. I've worked at several civilian institutions as well as the VA system. So I'd say some of my best days are usually when I have patients who may have complicated cases or recent hospitalizations that we can kind of flesh out the details of what happened, as well as assisting them in understanding what their medical diagnosis is and helping optimize treatment beyond just the medications that we typically provide, but more so understanding what causes these chronic conditions to kind of flare up. I try to not only talk about why we're giving medications, but also the reasoning behind why they have certain conditions to help them better understand their health care. So I went to medical school at Wright State University in Dayton, Ohio. Subsequently, I did my residency training with the Air Force at Wright-Patterson Air Force Base, which also works with the civilian hospital as well as the VA institution nearby. I am somebody who believes that putting good out there, the universe comes back and gives me opportunities. And I recall when I was applying for civilian opportunities that the medical director that I was talking to was selling me on this spot in Winters, which